for joining. We're going to get started here so we can get things off on time and hopefully get as much information packed in to this webinar as possible. My name is Ripper Hatch. I'm a Director of Partner Development with Positive Coaching Alliance. And for those of you that don't know much about Positive Coaching Alliance, which most of you probably do, we are a nonprofit organization based in Mountain View, California, who is trying to change the culture of youth sports, and we're doing that one step at a time with youth sports organizations and schools around the country. And one of our local chapters is in Chicago, and we've developed a relationship with Midwest Orthopaedic at Rush, and they have kindly offered to come on and talk a little bit about overuse injuries. So I wanted to introduce the folks we have on the webinar today. A couple of ground rules just before I do that is you can use your audio either dialing in or over your computer. You follow the PowerPoint slides on your screen. We'll advance them and everything. Please ask questions. We will have time to answer those hopefully during the webinar, so please ask questions when you have them. And the final thing, we get this question a lot, is this webinar is being recorded and should be available on PCA's website by May 15th. So if you want to go through it again, or you want to have somebody else that you thought should have been on it that would like to hear it, definitely we'll have a link for you. It'll be on our website by May 15th. So we look forward to giving you that opportunity as well. So introduction. Dr. Charles Bush Joseph, sports medicine specialist at Midwest Orthopaedic at Rush and the head team physician for the Chicago White Sox. Dr. Greg Nicholson, who's the shoulder elbow specialist at Midwest Orthopaedic at Rush and is the team physician for the White Sox as well. And then Brian Baum, the assistant athletic trainer for the Chicago White Sox. So those three will be going through some slides with you here. And I can tell you as a New York Yankee fan, I really am hoping that doctors that have the expertise that these guys have can help my poor Mariano Rivera. But I'll turn it over to you guys.
Well, thanks, Ripper. Thanks for the opportunity, and I want to welcome our audience tonight. This is really an interesting topic that really all three of the panelists, myself, Greg, and Brian, have a lot of interest in. You know, this is an area that's really seemed to be evolving our recognition of this problem, which has really developed over the last 3 to 5 years. I'm going to start moving ahead a little bit with the slides. Our panelists are myself, Chuck Bush Joseph, Greg Nicholson, and Brian Baum. For those of you who are involved in the webinar, I think you've been through this before. We want to thank our sponsors, the Positive Coaching Alliance. They do a fabulous job, and we really appreciate them providing us with this venue. Who am I? Well, I'm an orthopedic surgeon. I've been doing this for about 23 years. And I do take care of all kinds of athletes, whether it be young children all the way up to the professional athletes, or even what we call the elder athlete. I'm a team physician for the Chicago White Sox, and Greg and I both work with the White Sox and the Bulls and been doing that for a while. I've been sitting, I'm a member of the Major League Team Physician Association, the current president, and been on the Major League Advisory Board for the past 4 years. I'm kind of helping to guide, at least on a professional level, the care and treatment of the high-level professional athlete. But that's not our purpose tonight. Our purpose tonight is really talking about the youth athlete. We're talking about the young and developing child, the adolescent child, and the high school athlete, because really that's where the action is and where our biggest concerns are. So what we're going to talk about today is really a scope and the definition of what is overuse. What does overuse really mean? We'll talk about some causes and contributing factors, what sort of leads to it, who gets it, who doesn't, and why they do, the consequences. And really, some of them are short-term, many of them are long-term, and the long-term ones are obviously our greatest concern. Then Dr. Nicholson, Greg, was going to go through some specific injuries regarding how they occur, how we stop them, and then really how we treat them. And then finally, our final speaker, Brian Ball, is going to really help us get to the point of how to prevent them. And really, that's the ultimate answer here today. How do we prevent your children from coming to the offices of physicians at Midwest Orthopaedics at Rush? Certainly, we're happy to take care of your kids, but we think we do a better job when we keep them out of the office. So what is overuse? Overuse is really, it's a repetitive motion injury where kids are performing the same activity over and over again and leads to injury. So the analogy I'll kind of use, if you look at the metal involved in a paper clip, it's made of steel or some form of metal and very brittle and can withstand lots of stress. But if you bend that paper clip over and over and over again, eventually that paper clip will snap. And so that's the way we have to think of the same way about the young and developing body and the young and developing skeleton. Some of them usually lead to short-term symptoms, and that's when the child or the child's body is giving everybody around or everybody who's actually listening noise that something is going on. Because the general rule of thumb, kids don't complain unless there's a problem. Now, as parents, your job is sometimes to filter out what is a complaining kid versus what is the injured child, and that's what we're going to try to help you with today. What we don't want to do, is our second point here, is let any of these things develop into permanent changes to the body that result in lifelong disability or certainly lifelong abnormality for the child. How big is the problem? Well, the problem's pretty big. There's about 5 million kids under the age of 18 who suffer a sports-related injury each year, and about half of those are really overuse. So, well, the remaining half may be traumatic. They may be, kids fall, kids injured, kids collide, kids do this and that. But at least half of them are just kids doing too much without having a specific episode of injury, but they develop symptoms in a certain area. Until the mid-1980s, most times baseball was a game that was played underhanded. And even, I would say this today, while the overhand techniques began in the 1890s, arm problems have sort of followed it since. We even nowadays see underarm problems, and usually in the throwing shoulder. Here at Midwest Orthopaedics at Rush, we've done several nationally funded studies on the outcomes of athletes who are softball pitching, and young girls that even the stresses that they generate nowadays can produce these same type of injuries we see in the overhead athlete and pitcher. If you think about where we're going, it's why do we want our kids to play? Well, we want them to have fun. We want them to get better at their sport. Sometimes we're a little bit unrealistic about that. We think that every child is going to be a Division I athlete or professional athlete. That's not the case, but we still want our kids to get better and have fun. The main reason we have our kids play sports is fitness. We want them to develop lifelong health habits that lead to healthy bodies and healthy minds. Now, competition is good. I don't want everybody to go around and say that winning isn't everything, but competition is good because the real world requires competition. Your kids have to compete in school in their grades and the reporting, and that's an aspect of everyday life. And learning how to compete in a proper and efficient manner, in an adult manner, is really helpful. And then finally, the obesity, the epidemic of obesity. Almost 25% of the kids in the state of Illinois are classified as obese. And kids who play a vigorous aerobic activity at least an hour a day, 4 to 5 days a week, are much less likely to suffer the problems of obesity and all the consequences that come with that, including diabetes, hypertension, and such like that. Now, what are the factors involved? Well, the young skeleton is not a small child. Is not a small adult. They're children. Their bodies are growing and developing. The photograph you have of the young man here is a kid who was pitching too much at a very, very young age and unfortunately developed bony abnormalities in a growing skeleton of his elbow, such to the point that he's had permanent life alterations and unfortunately will now never be able to straighten his elbow out again. The x-ray you're showing on the bottom is actually a venogram of a youngster at a high school age who was pitching over and over again. He had both his teams, his school team and 2 different league teams that he was playing, pitched a doubleheader, and then 2 more games following that, and the following Sunday and Monday, developed acute onset of swelling in his arm, and really got to the point where actually he had a thrombosis or a clotting of the vein, the major vein that supplies his arm. Now, this is actually a very serious complication that unfortunately has life-threatening complications as opposed to the upper photo, which really just shows more skeletal problems. So what are the cause and contributing factors? Well, there's some things that we've seen outlined, and a lot of the medical research would kind of support, is that year-round specialized training for young athletes is a major concern at these points. Now, that's not to say it's bad, but if it's performed in an improper fashion, it does lead to a higher risk of injury. For example, the child who plays pitcher or catcher, he's throwing the ball anywhere from 50 to 70, maybe 80 times a game in his Little League game. He's going to go after that Little League game and go, he's got a travel ball game that evening, or certainly a showcase type event during the weekend. Upon completion of his 2 or 3 seasons, he's going to go into an off-season training program and private coaching sessions. And that private coach, you're paying him, he wants to give you a good service, so he's going to make sure that your child's working very hard during that coaching session. It leads to lots of throws, lots of swings, lots of hits. Our experience and our medical literature has shown us that kids who don't have periods of cross-training, or at least take 1 3-month block off of the year, are much greater likelihood to have an overuse type injury. When you use those same muscles over and over and over again, they'll fatigue. The simple concept is kids who become single sport athletes at a young age are much more susceptible to injury. And kids who participate in a single sport for 12 months a year have a likelihood of 4 to 5 times more likely of having a serious injury, even requiring surgery. So to that extent, you should not have a 12-month-a-year baseball player in your family. You should have no more than a 9-month-a-year baseball player in your family, and better off at 6 months a year. Either event, your skill will still develop. So if you look what are the other contributing factors, really it's us as parents and it's us as coaches. 9 out of 10 parents underestimate how long a child should refrain from playing one sport or another to protect them from these overuse or overtraining, or more concerning now, are just the plain burnout issues. 92% of parents say they rely on coaches to keep their kids safe, but unfortunately kids are coaching in the moment. They're coaching in that season. They're coaching in that game. They're coaching in that day. And nearly half of all coaches said they feel pressure to play an injured child for the pressures of the moment. We're all coaches. I've coached my kids, and I can tell on numerous occasions where I got wound up in the moment and got excited and thought that, well, in this time I can get away with it. And unfortunately, that's not the right answer. I'll just summarize briefly before we move on to Dr. Nicholson. So where are the common things we see? Well, in knees, I know I've got listed up here ACL injuries and patella dislocations. Well, no, those are not overuse injuries, but those are injuries that occur as a result of overuse. Those are kids who are either tired, deconditioned, or playing beyond their exertion level, and they lose that protective ability. They lose that quadricep and hamstring function, so that when they go to plant or cut real hard, they're not ready at that particular moment, or may even be fatigued, and, quote, the knee gives out. Obviously, shin splints, which is a real common overuse injury we see in young adolescent runners or young adolescent hardcore players like who playing tennis or basketball. Those are a combination of factors: overuse, hard surfaces, improper shoe wear. Now the soccer one, I put this one in here because this is one I see a lot of. I do a lot of hip arthroscopy, and I have lots and lots of hip families bring their children to me, young adolescent boys and girls, who say, my daughter's got a hip labral tear. Well, they really don't have a labral tear. They've just got overuse of their hip flexor, which becomes horribly sore, no different than a rotator cuff tear. And we're seeing young kids getting operated on at a premature age because there's either misinterpretation of their symptoms in studies, or there's kids playing too much. One thing that here in North America, we have a tendency to overcoach the driving the ball hard while kicking. Whereas if you look at South America and Europe, they have a greater tendency to emphasize foot skills as opposed to that hard driving kick. Now, stress fractures is one thing that we see a fair amount of, and again varies from sport to sport, kind of similar to what you see with shin splints. In gymnastics, gymnastics is a tough sport because these are very young kids, very often young girls whose skeletons are a long way away from growth and development and are very susceptible to growth plate injuries of the wrists, elbows, and the lumbar spine. If you look at stress fractures of the lower spine, in the normal population occurs anywhere from about 3 to 5%. But if you take a history and survey of experienced to retired gymnasts, that incidence of stress fractures of the lower spine is anywhere from 15 to 18%. There's so much hyperextension activity involved in gymnastics, you have to be careful. So when your kids are having mechanical low back pain, you must be careful. Finally, in volleyball, we see the knees, but more concerning is the shoulders. And the shoulders are very similar to our baseball children, where they're just spiking and blocking all day long. And we'll show you some examples in a little bit. Here's an example here of a young woman, a high school player, who's been playing in 2 club teams in addition to her school team. And if you look at the shoulder blade on the right side, obviously she's facing away from the door, you see the scapula coming almost right off her chest wall. And this is an example of scapular dyskinesia. And this can occur from a variety of reasons, either nerve damage, muscle fatigue, or certainly shoulder muscle imbalance. And it leads to lots of situations of pain and some secondary rotator cuff problems. Dr. Nicholson will speak a little bit more about these type of things in a bit. So with that as an introduction, I know I gave you a lot of information. I'm going to let my partner, Greg Nicholson, very experienced at these things, kind of drill down a little bit and take you to some of the more specifics.
Thanks, Chuck. My name is Greg Nicholson. It's a pleasure being on the webinar tonight. I've been involved with professional baseball since 1992. I do help Chuck with the Chicago White Sox, and my primary interest is in shoulder and elbow problems. Now, shoulder and elbow injuries can occur in any overhand athlete. Obviously, we'll focus a little bit on pitching because it's a touchstone for us, but we're going to talk about some injuries along with treatment. Now, one of the important things is to understand the phases of a pitch, but also if you look at the bottom of that slide, throwing, tennis serving, freestyle swimming stroke, and a volleyball spike are all very similar shoulder activities. So what we have is a wind-up, an early cocking phase, a late cocking phase, and then between the late cocking phase and ball release, we call that the acceleration phase. You then have ball release and then follow through. And interestingly enough, we would probably just look at that and think that the problems reside early. In reality, many of the problems occur during follow through because you must dissipate the energy of the throw. And in a young skeleton with young muscles, this may not be developed very well as you do these repetitive activities. You need to know the throwing mechanics when you're talking about this. Why? And we'll talk about this in a second. You have the mechanics, and then you talk to the injured athlete, and you got to get the history. How old are they? Are they between 10 and 14, or are they between 14 and 18? Those are totally different human beings. What position do they play? Typically, you ask them, and they say, well, I pitch, but I haven't pitched in 3 weeks. And, of course, you ask them, what other position do you play? What do they say? I catch. So they're throwing as much as the pitcher. Where's their pain? Where's the location of the pain? What phase does it occur in? Does it happen when you cock the tennis racket back? Does it happen when you impact the volleyball? Does it happen when you release the baseball? Those kind of things. And then I always ask them about their coach. Now, look, as Chuck told you, we're all coaches, we're all dads, we're all parents, but sometimes the dad is the coach, and there's a dynamic there that may not be healthy, and that's sometimes good to know. The reason you need to know the mechanics and the history is there's a significant age variation in the pathology that you're going to encounter, the diagnoses that comes into, the treatment that you might do, the response to that treatment, and then, of course, the restrictions you might put on the athlete, and Brian Ball is going to talk a little bit about that in a little bit. Now, there are 5 major risk factors for injury. The first one, controversial here at the top, breaking balls at an early age. In a survey of Major League Baseball players, they asked, what age did you start throwing a fastball? And, of course, it's age 10 because that's when you start playing Little League. And then the curveball is the second pitch. It might be advantageous to learn the changeup as opposed to a curveball. The other problem is, do we teach a curveball correctly? No, not really. You learn it from the kid down the street because he throws a curveball in the backyard and he always gets you out. So now you throw that curveball and it's kind of not right. But an interesting study out of North Carolina over the span of about 5 to 8 years found that maybe it's not the type of pitch that you're throwing, it's how many. So too many pitches in a game and too many pitches per week without enough rest in between predisposes you to injury. Then there's poor mechanics. Well, as Chuck Bush-Joseph told you, why do you have poor mechanics? Fatigue. When do you get injured? The 4th quarter and the last ski run of the day. Why? You're tired. Poor practice and poor conditioning can come into it. And then there's genetics. Some people can throw really, really well and are never going to get hurt. The other guy can look like a Greek god and break down all the time. And that's just something we deal with, and so that's tough. But these 5 risk factors are things that can really create some problems at any age. Now, as we stated a little earlier, these age-related diagnoses don't get wrapped up into the technicalities here, but in a younger age group versus an older age group, the shoulder and the elbow are a great mimicker. You can say, oh my goodness, it's your rotator cuff. Well, you may be half right, but these diagnoses overlap in their presentation. So as we think about these athletes in the younger group versus the older group, we're able to discern what might be going on. Now, how about a young thrower? Let's define a young thrower as age 10 to 14 and their growth plates are probably open. In this x-ray, right here, if you can see that, that is the apophysis or a growth plate of the medial epicondyle. It is widened. It is widened because of traction from repetitive throwing. That is called little leaguer's elbow, and they get medial elbow pain, and it does hurt, and they can't throw. Same thing can happen in the shoulder. So So from the standpoint of prevention in these youth throwers, a couple things: pitch count, pitch type, mechanics, coaching, and communication. Now, in young throwers, which is, let's call those, or youth throwers, let's call those age 14 to 18. Now you have a developing skeleton. They're getting stronger. They're getting faster. The amount of force, the requirements, the expectation, and the intensity of what they're doing increases. Thus, the injury conditions in the shoulder and the elbow can increase also. Again, we have a laundry list of diagnoses here, but again, it's what we think of as we see these kids going from young throwers to youth throwers, the type of diagnoses we see. Again, prevention and treatment are pitch count, pitch types, proper mechanics. Now, as Chuck Bush-Joseph showed you, in the child's elbow, they lost flexibility and range of motion. As Brian Ball will tell you, this is imperative in these youth throwers. They can lose motion in the shoulder and the elbow quite quickly, and you have to keep a stretching program. They've got to stay flexible. They've got to stay strong, and thus their mechanics will stay better. We did mention showcases. As you get up into older age groups, showcases can be very damaging. It might be October, November, you've thrown a little bit, and then to show off, so to speak, to a college or junior college or travel team, you go out there somewhat cold, you haven't really played in 3 weeks, you warm up a little bit, then you're trying to throw a 95-mile-an-hour fastball. I can think right now of about 12 to 15 cases that I've had to operate on directly related to showcases. So it is not a good idea. Just something about elbow injuries here very specifically, because we all heard about Tommy John. Everybody knows about Tommy John surgery. And anytime a youth or young athlete comes to our office with medial elbow pain, they immediately assume it's a Tommy John injury. In reality, it is most likely an overuse problem. They can have ulnar neuritis. They can have tendonitis at the medial elbow, also known as golfer's elbow. You saw the x-ray of little leaguer's elbow. Also on the outside part of the elbow, there are differing diagnoses also. So age and location are very important both for the shoulder and the elbow in treating these problems. Now, what are the danger signs of an injury, both for us as treaters but also as coaches and parents? As we mentioned earlier, if you are in a repetitive motion sport where you swim, you throw, you serve all the time. For example, we used to say with the White Sox, when one of our starters throws 80 pitches, what does he do the next day? He doesn't throw 80 pitches. But in volleyball practice, you have a 16-year-old girl and she hits for an hour and a half. So that's probably about 80 spikes. So what do they do tomorrow? They hit for an hour and a half. What do they do the next day? They hit for an hour and a half. What do they do over the weekend? They play 5 games, and then Monday they hit for an hour and a half. So one of the danger signs is loss of performance. Do they still have the same speed and location, be it their swimming stroke, throwing, and it doesn't have to be a pitcher, volleyball. Alteration of mechanics, and this is where we as coaches and parents will probably pick it up before anybody else, because you know what your kid looks like. You know how they walk, you know how they talk, you know how they wear their hat. You can tell the elbow's dropping or there's something wrong, because they're not going to tell you about pain off the get-go. Then they may complain of pain, or every night they come home and say, Mom, where's the Advil? Okay? And, of course, that this isn't going away. So those are the danger signs. Treatment. Well, you got to stop the activity. Doesn't mean you need to sit in a chair, because if you do, most likely they start playing Call of Duty, and that's an overuse injury also to the hands and wrists, but that's beyond the scope of this talk tonight. So you stop the activity that got you into trouble. You get an evaluation by a trainer like Brian Ball or a sports medicine specialist. Then you may not diagnose this on the first exam, because you got to kind of peel the onion of all the overuse kind of leftovers. You need serial examinations. Take that history. When does it hurt? When did you first start feeling it? Did you get it with ball release? A good physical examination by a specialist and a good serial examination. And then the proper imaging. We see so many people walk into our office with a gadolinium arthrogram MRI, and it's just not something that we would do first. Treatment, therapy, and very importantly, the response to that therapy. Non-steroidal anti-inflammatories in a short course are very good to decrease inflammation. Serial examinations, and then a planned return to sport in a gradual way. Now, in young and youth overhand athletes, as Chuck Bush-Joseph mentioned, we do not recommend that you play all year round. Cross-train or play. And there's not enough play anymore. Now, we're a whole different society, and I'm not going to tell you to go out and play stickball and other things like that. Kids are very scheduled today, but you need to do something besides 12 months of the same sport. Scapular and rotator cuff health and strength, and core and leg strength are vitally important as you get into the younger thrower, that adolescent thrower, and Brian Baum will talk about that. If you have decreased performance or pain, you stop, you rest, you evaluate, and then you rehabilitate. Now, in high school and beyond, there's a lot of things in the popular press about the increase in injuries, the increase in rotator cuff surgeries, and Tommy John surgery. Again, this, as we're talking about today, look, this country, we play, and it's competition. But there are things that are occurring where kids are playing, and it's a little bit of emotional blackmail to play that sport all year round, or you're not going to get to play the next year. So that they focus on one sport very, very early, and I think that's part of the problem that we're seeing. Now, of course, there's always a worry about whatever you do, and these injuries can lead to long-term problems in adulthood. Now, there are no definitive studies about this, but there's clearly a trend that injuries in high school or college that require surgery or stop your participation in that sport definitely lead to issues that will require medical attention later in life. That doesn't mean you're going to have arthritis necessarily, but there is a trend there, and that's what we'd like to prevent. In summary, when you're talking about an overhand athlete of a growing skeleton, there needs to be proper limits. You need to learn the proper mechanics, and if there is a problem, an early evaluation by a specialist can save so much time, direct the rehabilitation. And that is what we all want because, of course, we want a quicker return to form or certainly a much more quick definitive diagnosis, which will lead to better treatment and hopefully another quick return to play. Everybody wants to get back on the field. We understand that, but we want to do that safely and effectively. I'm going to turn that over now to Brian Ball, who's the assistant athletic trainer for the Chicago White Sox, and is going to hopefully help us with some of the training methods and some of the treatment and prevention.
Good evening. Thanks for having me. Appreciate it. Like Dr. Nicholson said, I am Brian Baum. I'm the assistant trainer with the White Sox, and I want to talk to you guys tonight about some ways of preventing injuries in baseball and other youth sports as well. Basically, looking at prevention is the key of pretty much everything, and keep guys out of the doctor's office, keep your health insurance costs down, those kinds of things. If athletes start developing preventative strategies when they're young, they're going to be able to play sports throughout their whole life, and they'll be able to avoid injury as well. Why rest may not be enough? Well, sometimes when you get injured, and we have overuse injuries, you're going to lose muscle tone, loss of flexibility, loss of endurance. And anytime there is painful, limited joint motion for more than 24 to 48 hours, then you're going to need to see the doctor. Basically, sometimes rest just isn't enough in order to get over an injury. So you need to be very aware of signs of when you need to seek professional help. USA guidelines for youth baseball says that pitch count, you need to watch pitches per game, the pitches that they pitch per season, and a year. Not just total pitches and from the 9 to 14-year-olds, especially more than any other group, because that's the group that tends to get hit the hardest in Little League Baseball. You need to encourage your kids to have good mechanics and good conditioning. Discourage your kids from throwing breaking pitches. Make sure that they learn the fastball and the changeup first before they start throwing anything else. Discourage your kids to play in multiple leagues. Pick a team, play on that team, and if you're going to pitch, as Doc said earlier, if you're going to pitch, don't catch as well. Encourage your kids to play another position. Avoid showcases. Nothing good ever comes out of those as far as injury prevention, because someone always gets hurt in showcases. And discourage year-round baseball. Little League Baseball has a rule on the pitch counts. Pitch counts per game. 17 to 18-year-olds can pitch 105 pitches per game. 7 to 8-year-olds can go 50 pitches per game. So you can see there's a big gap there in what Little League Baseball is trying to do to help prevent injuries. Days rest after pitching that is required. If a kid throws 61 or more pitches, he must have 3 days off before he gets to pitch again. If he throws 41 to 60 pitches, he has to take 2 days off. And if he throws 21 to 40 pitches, he has to take 1 day off. The American Sports Medicine Institute position statement 2009 says, watch and respond to signs of fatigue. That is a key to prevent injuries. When you see your child start to have bad mechanics, or they're coming home and complaining, or you're noticing that they're just not hustling things out like they usually do, start watching that. As coaches, we're all, we definitely need to watch for those signs. Those are the biggest signs, because if we can watch for signs of fatigue and we can stop it and shut them down at that point, then we really can save them a lot of heartache and headache down the road for your team as well. You'd much rather lose a kid for the night than to lose them for the rest of the season or forever. No overhead throwing of any kind for at least 2 to 4 months per year. As we said earlier, baseball is not a 12-month sport. Don't try to get your kids into different leagues where they can play 12 months out of the year. I'm telling you, it's not going to work out. It's not going to have a good end result for you. No competitive baseball pitching for at least 4 months per year. Again, that means 8 months of pitching. That's a lot of pitching in 8 months. Avoid using radar guns. It's not about how fast your kid's throwing the ball. It's about the quality of pitch. And avoid pitcher-catcher combination. What that means is, as it was said earlier, don't let your kid be a pitcher and a catcher. They can play the outfield or an infield position or something like that. The catcher throws the ball just as much as the pitcher does. And inspire your kid to participate and enjoy other activities and other sports. If he plays baseball, have him play basketball, have him play tennis, golf. There's plenty of other sports that he can play to keep up his physical fitness without just playing baseball for 12 months out of the year. Tips to keep you in the sport: always warm up properly. That right there should be bolded, because that is by far the biggest key to the whole thing about prevention. Is if you don't do something before it happens, then you can't prevent it anyway. So warm up. Make sure you take some time. Coaches, make sure you're giving your teams time to warm up. You can't warm up in 5 minutes. Give them about 20 minutes, a nice good stretch, get their legs moving, get their arms moving, play catch, and then get into the practice. Vary the positions on the team. Again, like we said earlier, don't just pitch. Have another position. Follow the guidelines established by Little League Baseball. Coaches, that's to you. Parents, that's to you. There's no reason to push your kid into the situation where he's going to get hurt and then he's not going to be able to be an athlete when he grows up. Don't pitch on consecutive days. In the big leagues and Major League Baseball, our pitchers don't pitch on consecutive days. We have some bullpen guys who do, but they won't pitch on consecutive days if they have so many pitches that they throw that night. Don't play year-round or on overlapping leagues. Again, that's been said 1,000 times a night, and we cannot stress that point more than anything else. for your child. If your child's experiencing shoulder or elbow pain, discomfort, communicate with them. Communicate with your parents. Communicate with the coaches. Tell them how you feel. Make sure that parents, if your kid's coming home and he's telling you that his shoulder or his elbow's hurting or anything like that, make sure you're talking to the coach as well. It's always good to communicate. If we can communicate, then we can really shut down a lot of these problems. And never, ever, coaches, parents, players, never pitch with pain. And if you have persistent shoulder pain or elbow, excuse me, if you have persistent shoulder or elbow pain, you need to see an orthopedic surgeon. And continuing on, concentrate on good mechanics. Concentrate or control and accuracy and not speed. Again, the radar gun means nothing. You know, you can throw 100 miles an hour, but if you don't know where that pitch is going to go when you let go of it, 100 doesn't mean anything.
No, if you don't mind, Brian, I'd like to interpose a point here that I think is important. One of the things that, and Greg, I'll let you chime in on this, most of the studies have shown, and this is for you youth coaches, velocity does not come from the arm and shoulder. For a child to gain velocity, or an adolescent or a high school pitcher, they gain velocity on their throw. Their ability to throw a fastball is coming out of their legs and out of their low back. The purpose of this arm and shoulder is to control the pitch and to control the location, but velocity does not come from the arm and shoulder. So to that point, and I think we'll get into this in a little bit, I want to reemphasize that the conditioning of areas outside of the arm and shoulder are really very critical to avoiding injuries of the arm and shoulder. Sorry to interrupt, Brian.
Right. No problem. And again, as Chuck said, he's exactly right. You know, the velocity of the pitch does not come from the shoulder. It comes from the core and down through the legs. So next point is master your skill before trying something new. What that basically means is perfect the fastball before you move to the next pitch, and perfect that next pitch before you try to do something else. And make sure you're throwing with good mechanics. Learn from your coach how to throw that ball. Don't learn from the kid down the street just because he's able to strike you out. And I speak with a sports medicine professional, like an athletic trainer, if you have concerns or about injuries or ways to prevent them as well. What does it take to get better? Well, when you have an overuse injury, you want to work on aerobic fitness. That means you're going to work on, your rehab exercises, muscle training, and strengthening. Core muscle strength works with everything. It doesn't matter what the sport is, from gymnastics to volleyball to swimming to baseball. Core muscle strength is everything. That's your low back, your abs. Everything comes from the core. And if we don't have strong cores, everything else is going to break down. Something's going to break down somewhere in the chain. Speed and agility, extremity strength, that's strengthening your legs and your shoulders, rest, and cross-training. And what that means is cross-training is practice your sport. Core fitness, well, how do we treat our ball players to avoid injury? Again, I said it before, we warm them up. You know, we spend 25 minutes a day and warm up and stretch. We get guys out on the field. We go through a light active warm-up, we call it, where they're doing maybe some 40-yard, nice, easy jogs just to kind of break a little bit of a sweat. And we work on stretching. We stretch every joint. We stretch every muscle that we're going to use, and even the ones that we're not going to use, really, to be honest with you. Workout, in the workout there, that's talking about the practice or batting practice or the practice session, you know, whatever your sport may be. And then a cool down at the end. Don't just stop throwing, or don't just stop running and jump back in the car and take off and go home. You know, cool yourself down, and that includes stretching your legs, stretching your arms, and doing some light strengthening activity. Just some examples of some shoulder strengthening exercises is the shoulder blade hold, which you see in the slide. Shoulder shrugs is where you shrug your shoulders up and roll them forward, just pinching your scapulas and moving the scapula forward and backward. Internal and external rotation with a resistant band. That's where you're You can use a band or you can use the wall. We will have some more information about that at the end. And if you go to our website at rushortho.com, you can download the free brochure on exercises, and it'll show you the shoulder strengthening exercises, and I'll talk to you about some tips to avoid overuse injuries in young athletes.
Well, I want to thank Brian and Greg for an excellent review. You can see on our slide we have up right now, these are the websites we'd like you to visit, thepositivecoach.org. Clearly there's some valuable information there, a variety of webinars such as this and some of their other informational YouTubes that I think all of you will find very interesting. I want to thank everybody for participating, but we're not going to let our speakers get away. We've got a number of questions that have come in, and we're going to sort of run through the group on this and kind of get the opinions. The first question was from Ron Lambert, and he said that he spoke to an orthopedic, he has a 13-year-old, and Greg, Dr. Nicholson will give this one to you. He said his orthopedic surgeon advised that his son does not play baseball before the age of 13. What's your opinions on that, Greg? A child can throw before that age. What's your thoughts?
For sure. The issue is, in today's society, the problem is, and there's pressure, direct and indirect, on the kid, that if I'm not in that environment by age 13, the coach isn't going to look at me at age 14, and you got to develop a skill set. I think if the parents are concerned, I think the child can play baseball, but maybe you do not decide to throw them in to be a pitcher. The pitcher seems to be that sexy, alpha male kind of position. Nolan Ryan did not pitch till he was 19 or 20. He was an outfielder. He pitched for almost 25 years in the major leagues. Another one, Dave Stieb, showing my age here, pitched for the Toronto Blue Jays, played outfield till he was 21. He did not pitch in high school and college. So I think play baseball, learn the game, and find the position you like. There's no reason to not play.
Well, I would say the specifics of the question was, should your son not pitch before the age of 13? Of course I think your son can pitch before the age of 13. As long as they follow the guidelines that I think that Brian spoke about in terms of pitch counts, pitch frequency, and the types of pitches, I think it's safe. And certainly, obviously, you can't play baseball without a pitcher. So to Ron Lambert, I think with proper guidance, proper coaching, and following the guidance, I think I would let my son play. At least I did mine. So we've got another question here. This is from Allison. How long should an athlete deal with pain in his shoulder before seeing an orthopedic surgeon? I'm going to hand that off to Brian. Brian, obviously you're taking care of the most elite athlete, certainly very high-paid athlete. To what degree of moan do we let these guys talk about before they're seen? And what would you allow your child, Jacob? How quickly you're going to have your son seen and examined?
Good question. I think that as far as dealing with shoulder pain, there's a difference between some soreness and pain. Once you get to the pain, once you're talking about pain, I think that you're probably shifting over to seeing the doctor pretty soon. If he's coming home and he's sore and he's been throwing a lot or something like that, I'd probably give that, probably give it a couple of days, maybe not have him throw for a couple of days, see how he feels, but I wouldn't let him sit for much more than probably 3 or 4 days.
As a follow-up to the previous question, what guidelines or recommendations do you have for a 13-year-old baseball player who's also swimming competitively? Greg, I think this is kind of what we want. We want the athlete who's playing more than one sport.
That is correct. However, I will put a disclaimer here. If they're playing all 6 months of baseball and then they are swimming, yes, they're using different muscles, especially in the pool. However, it is an overhead, repetitive, athletic activity. And as I always tell my patients who are swimmers, if I've got a guy who has a sore arm or is pitching and is coming back, he throws a ball with velocity and location every 30 seconds and gets to kind of walk around the mound and, set his defense. But a swimmer has to stroke probably about every 10 seconds and can't stop. That combination, as you get up into 14, 15, 16, may be a very difficult combination, to be honest with you, because you're playing 2 repetitive overhand sports.
I've got another question from Liz from Kalamazoo. I think Liz asked, there's so much pressure to play year-round. My son plays travel soccer August to June, and we'll do 2 summer week camps. is this too much? Should they take 3 consecutive months off, and is it okay to take a few weeks off during the winter? Well, Liz from Kalamazoo, I think for me the answer is that in the throwing athlete, they've got to have a 3-month block off. Now, the lower extremity athlete, the running athlete, such as the soccer player, the distance runner, we can break it up, and we're not as hard and fast on that same rule, but I still believe that the problem is the kids that don't have seasons off from any particular sport suffer as much burnout as they suffer from overuse injury. And so you've got to guide that. On the overhead throwers, we're going to stick hard on that thought that they've got to have 3 months off from throwing, and that means 3 months off from throwing.
Chuck, if I could interject on this one, too, this is kind of and I don't think I can change it myself, and it's a parent and a coaching issue, but it's society right now. And there's this issue that you must, as we alluded to earlier, you must pick your sport because the competition's so fierce, and if I'm going to participate in high school, I have to do this all year round. And I think this happens in the female athlete sooner than the male athlete. The male athlete's allowed to play a couple of different sports. Hey, I'm going to play baseball and football. But the female athlete, especially swimming, volleyball, and soccer, you're going to play high school volleyball, but the club is more important. You want to swim? Well, there's club swimming, water polo, long course, and short course. And if you ask a parent whose daughter is playing volleyball and you ask them when the season ends, they say immediately, it never does. So I think in our female athletes, we're actually forcing those girls earlier to play one sport, be it soccer or whatever. Because the thinly veiled threat is if you don't play the indoor winter, you're not going to play on my team come this spring. So it's difficult, and that's something the Positive Coaching Alliance, I think, is addressing, but it's going to take a long time for us to change that. And it's just because we want our kid to be on the team. The kid wants to be on the team. And I don't know where the happy medium is, but I see this overuse issue much more in girls at a younger age, I think, than I am seeing it in the male patient.
Greg, I would just emphasize to that, these are problems of disappointment. And as parents and as coaches, we deal with disappointment all the time. Adults are more akin to that and know how to deal with disappointment and failure, much more so than children and adolescents and even teenagers. So not everybody becomes a professional athlete. Not everybody becomes a D1 athlete. You want to give them the best opportunity, but you always have to be realistic in your mind and in your heart in terms of how you're going to handle your children on this. All right, we have another question from John Farrell. John has a question for Brian. John, Brian, how do you differentiate between active and passive stretching? And tell us what are your strategies that you use for your professional athletes in these types of methods? First, why don't you define static and dynamic stretching, at least as how you interpret it?
Well, static stretching would be more of the low impact type stretch where you're statically stretching the joint, and dynamically would be the activity, would be the running or jumping or the action actually to stretch out. So what we do is we do static stretching pregame, but just before we end it all up with an active warm-up. So we do dynamic stretching as well, and it's very important, we believe, to do dynamic stretching right before the activity starts.
We got another question here from Ann from Peoria. Ann's asking, what sport do you think is the safest? Well, Ann, I got to tell you, I think whatever sport your child likes to play is the safest sport, because that's the child where they're going to want to participate. They're going to find positive response to their participation, and they're more likely going to excel. So I would not be in that position of pushing my child to one sport or another because I think one is safer than the other. I'll admit, I'm an orthopedic surgeon, and I've raised three children who played a variety of sports, from rowing to tennis to football to lacrosse to volleyball, even gymnastics, which is a sport that I just seem to see have a relatively high injury rate. I think when my son or my daughter comes home smiling while participating in that sport, that's the safest sport. Then it's my job to make sure that they're not putting up red flags, either overtly or covertly, that I recognize to say, when have they gone beyond having fun and training as opposed to causing themselves harm. So you won't find us or pin us down on saying what are good sports and bad sports. We got another question here from Jeremy. What should you do for a basketball player who catches cramps after the game? Brian, you've seen cramps before.
Yeah, well, usually, cramps are coming from a dietary issue. What we would do with someone like that is we would get them on some sort of potassium or calcium supplement. I'm not going to sit here and say get your kids on supplements or anything like that. A banana after the game, a Gatorade, get some electrolytes, things like that. Those things will help take care of that. And stretching, cool down stretching also helps with prevent cramps.
Yeah, rehydration, cool down stretching are really clear ones. We've got another question from Eugene Lynn from Kansas City. This is for Dr. Nicholson. The support system off the field is crucial. How do you believe the win-at-all-cost mentality has affected coaches to intensify practice? So really this is a question about coaching, and how do we properly coach coaches, Greg? What's your thoughts on that?
As we were talking about earlier, we're a competitive society. America likes to win. Coaches like to win, and they think the kids are happier when they're on a winner than on a loser. And I think it goes back, though, to what Brian was saying. There's a pre-game, there's an inter-game, and there's a post-game. You can stretch, you can work out, you can cool down. Same thing happens with the pressure to play or win. The coach needs to be able to develop the talent, encourage the talent of the best kid versus the not-so-talented kid. If that's not occurring in a youth sport issue, it's difficult because in today's world, think about it, high school sports, junior high sports, whatever, they tell you straight out, they do not want the parents communicating with the coach. The young athlete needs to bring their concerns to the coach. Most kids between the ages of 12 and 16 don't have that skill set, and that's a problem, and that's where things continue to kind of snowball. So that's the Positive Coaching Alliance, and I think this is going to take another 5 to 8 years because we've got ourselves into this mess a little bit.
I got another question for Brian. This is from Andrea from Charlotte, North Carolina. Brian, what do you think about the use of kinesio tape? Obviously, we see our professional athletes with all kinds of tapes and straps and compressive sleeves. Give us your general thoughts on these types of devices. Where do they fit and where don't they fit?
Kinesio taping is used for a variety of different injuries to help get back. It works on the lymph system and supposed to limit range of motion, kind of give you like that spring back. The kinesio tape is made from a material that has some elasticity in it. Personally, I don't use it that much, not because it's good or not good, just that we typically use other forms of taping. But kinesio taping, many people use it and they have good results with it.
I would say that, in the professional athlete, and this is something that our professional athletes are inundated by major manufacturers, which I won't name. Obviously, everybody when they've got new products on the market, they're going to want to put them on our athletes because those athletes are role models. And so when they see a Chicago Bull or Chicago White Sox player with a certain type of wrap or a certain type of band and strip, that player may find it effective, but that doesn't mean it translates to every player, and it doesn't mean it translates to youth and adults. So we have some caution. Certainly, I believe there's lots of value in the variety of medical equipment that we use on our athletes, including compression sleeves, braces, and such. But I want to tell you, they're not all magic, and there's certainly no single answer for every child and every problem. I have another question from Dan Slane. What are the best exercises to prevent ACL injury for female athletes? Well, there's lots of new information on this, and I think obviously I think many of you in the audience are well aware that high school girls will tear their ACL at a rate of anywhere from 4 to 8 times high school boys or the equivalent age group. There's a variety of factors that. Usually it's there's a little bit different shape to young women's bodies than there is to male bodies. Their hips are a little bit wider, their knees a little bit narrower, so they have a tendency to have weaker hips and pelvis. Number 2, that they oftentimes don't have that same muscle development at the same rate of boys. In the growing child, the skeleton grows, the muscles catch up. And in girls, when the skeletons seem to grow a little bit faster, and they don't have that same muscle mass and that same muscle positioning. So really, the most of the learning techniques we've learned is jump trial techniques. And if you go on ACL prevention, you'll see lots of information on how girls land. It's that athletic position that Dr. Nicholson always yells at his basketball players. You've got to be butt down and knees bent. That narrow base gait, when little girls land with their knees extended and hips extended, they land in a straight up position. That's a recipe for disaster. So the athletic position, teaching your athletes the athletic position the proper way. We do like plyometric exercise, lots of jump training, box training, jump rope, things that help explosive strengthening, specifically of the hamstrings, seem to show some evidence of declining or decreasing that incidence of ACL injury in the young female athlete.
Chuck, I've got one here for you and Brian from Patty. Volleyball seems to become a specialized sport at a very early age, and we mentioned that about the girls seeming to be put into that where you got to do it all the time. And they're seeing more and more stress fractures in the back in this sport in all positions, but mainly in the hitters, in addition to low back pain. In your opinion, do you think this increase is due to overuse, bad mechanics, poor core strength, or a combination of the above? And what, as coaches, can you do to be aware of these type of injuries? So we're talking about, again, somebody jumping, somebody hitting, but now it's not a shoulder issue, we're having low back pain.
I think it's a combination of all those things. You know, I think it's core strength, obviously. I think that there's definitely overuse in volleyball, as you spoke about earlier, how that there's just so much repetitive overhead hitting, and you know, as you're going over your head, you're using those core muscles, and you're putting pressure, you're putting strain on the low back, and mechanics. Obviously, mechanics will play a big role in that. If you're hitting the ball improperly, landing back on the court improperly, I think that I truly believe that stress fractures are overuse injuries anyway in nature. So I think that probably just the repetitive up and down and overhead motion is what's causing it.
And I would imagine Patty's question has to do with probably a high school age group. You're very familiar with gymnastics. You know a competitive gymnast very well, your wife, and she had some back problems, did she not?
Absolutely.
And so there is an issue there where you're using the core, you're extending your spine, and then you're landing again. You're doing this over and over again. I would never say, hey, you should only practice 3 days a week, and I'm sure that's happening in volleyball, but there is a tremendous repetitive activity in volleyball. You know, I don't know if they dig and yes, they serve, but it's a very repetitive practice atmosphere.
You know, Greg, I'd like to come back to that point, and I think we showed a slide earlier today. If you've got doubts, one of the best ways to sort of evaluate your young daughter is to look at them from the back and examine the position of their shoulder blades. If you sort of get a sense of their shoulder blades, if their shoulder blades are symmetric and stay symmetric with forward elevation of the arm as they take their arms from at their waist all the way overhead and come back down, that's generally going to tell you it's a healthy shoulder. When you see a lot of what we call dyskinesis or asymmetry of those shoulder blades as they raise their arms up and down, that's probably a red flag, probably something to be concerned about. Your child a little bit more about, and maybe certainly if it's significant, you may have to seek medical advice on. I want to remind our listeners and our readers here that to visit rushortho.com. We have a brochure explaining all these concepts. I think through the Positive Coaching Alliance, again, you'll be able to see this webinar and be able to solicit specific questions. I've got another question here. There was Greg, another caller suggested, is there too young of an age to start children in baseball? I'll just throw my bias in right away. I was coaching t-ball and pitches coach when my children were 6 and 7 years old. So what's your thoughts on that?
Well, I think the community starts t-ball anywhere between 7 and 8 years old. There is no pitching, and as you know, it's more of a audience participation sport at that point where you cheer as the kid runs around all 4 bases. I don't think it's too early to start baseball in a t-ball situation. If you're playing kid pitch baseball at age 7 or 8, that's too early. That should be t-ball.
Well, I would tell you that having suffered through those early you go from a 65 to 80-minute game in kids and coaches pitch or T-ball to all of a sudden a 2-hour, 3-inning game. So I'm not a big fan of kids pitch until really a little bit older as well. Just for the performance of the kid, for the performance of the child. I would say that one of the things that baseball suffers in sometimes in those young ages is keeping the game moving well enough that little kids don't become bored. Brian, you're baseball.
I think that baseball is a game of life. You know, I think that there is no too young of age to actually start playing baseball or playing catch. And T-ball, I think, offers a great opportunity for young kids to learn the rules of the game and how to move around and have a glove on their hand. I don't think that there's too young of an age for.
You know, let me interject here a second. We're talking about organized. As I said earlier, we're such a scheduled society now. Tell your 6-year-old or 7-year-old to go out in the backyard and play wiffle ball and, you know, put some black electrical tape around the wiffle ball, make it heavier, play home run derby, play stickball, make up some weird game that if you hit it over the head, you get 10 points, and play wiffle ball or whatever it may be with your friends. That leads, it's play, right? We want to play. And that plus the T-ball, that helps kids grow and become the better athlete, the better kid.
They made it to the Wiffle Ball World Series one year.
Yeah. We've got another question from Paul from Dubuque, and Paul's question was, what overhead motion in mind and what other conditioning sport or exercise do you recommend other than swimming? Well, again, I don't want to pigeonhole that swimming is bad here. I don't have a problem with your kids swimming as long as they're, quote, doing something else as well. Brian, what are some of the ways that we condition our overhead athletes without throwing? What are some of the tricks that you use?
We do a lot of low weight, medium rep exercises. Shoulder strengthening exercises with bands.
Well, let me pin you down. What is low weight for our audience, and what is medium repetition?
Let's go 5 pounds, 15 reps.
And those are for adults.
Yes.
Those are high level conditioned athletes.
Yeah.
If you went into the Chicago White Sox training room and into the conditioning room, you'll see while we have some barbells and dumbbells around on the side, they're rarely, if ever, used. I think probably one of the things that we use the most of is the medicine ball. And certainly for those of you, even adult athletes, there's nothing that replicates a golf swing better or a hockey stick slap shot than using a medicine ball in the rotational activities. We've got another question here from Anthony. Do you have any routine stretches to use before a pitcher will pitch? Brian, again, I think this one's coming to you.
Yeah,
how long does it take? Obviously, on a professional level, our guys are arriving at the ballpark 3 to 4 hours early. I'm coaching Little League, and my 12-year-old, like Greg said, we're running out of the car and jumping to the game. What are the most effective, efficient ways that we're going to warm our kids up?
Obviously, is getting them out of the car and getting them moving around a little bit prior to their activity. As far as stretches for pitchers, it takes probably a good 10, 12 minutes to stretch out a pitcher's arm. A lot of internal, external rotation exercises, stretching. One stretch that is kind of the lifeblood that we use is sleeper stretch, and that's sleeper stretch is an auto stretch where you're stretching yourself, and you lay up on your side and internally rotate your shoulder. We may have that in our brochure. I'm not sure if it's on our brochure or not, but you can, on the website at rushortho.com, you can ask a doctor, and we can get you what the sleeper stretch looks like.
I've got another one here that's concerned me. It's hydration, Brian. Give us a little bit of your thoughts in summertime play. When do you think it's effective for water? When do you think they need sports strengths, fully strength sports strengths versus cut sports strengths? What's the approach that professional and collegiate trainers use on this?
What we're finding is that probably hydration probably is one of the major causes of injury. You see a lot of stuff happen, and you look at it and you go, why did this guy get hurt? What did he do that really created this incident? And a lot of times hydration is the problem, and so we're always, our strength coach is always yelling at guys, hydrate, and there's different ways of doing it. Water, Gatorade, any of the sports drinks. At the end of the day, water is king, I think, and I think that the key is, though, is as the summer goes along and it gets hot, is to know that once you get thirsty,
Too late.
it's too late to hydrate. You know, you've already passed that point where you're not really going to benefit. You still need to drink water, don't get me wrong, but you're already down. You're down quite a bit of water already, so you're not just going to take a sip of water and think that you're back to.
You know, the general rule of thumb that we've learned from, from years of taking care of marathoners is that if you have sustained athletic activity that goes for more than an hour, you probably need to replace more than water, and you probably should be using electrolytes. There's obviously the commercial. This is a very large industry these days, and I do believe the sports drinks have gotten much better. They're lower in calorie intake than what they used to be. They're not just, quote, sugar water and pounding calories into the kids. I want to get back to the overuse thing one more time. Greg, you know, when a child or an athlete, even a high school athlete, injures his shoulder and quote, is pulled out of the game for a little while, we don't let him just right back up on the mound. We take him through a throwing program. How do you define, what's a throwing program mean to you, and how would you explain it?
It's a great question, and I think every athletic trainer or sports medicine specialist probably has their own way of doing it, but it's based on the same thing. Number one, they have to be pain-free. Let's say they've been injured or they've had something. So you take them out, relative rest. Now they're pain-free. You don't just throw them back in the game. You gradually increase. What I like to do is have my baseball players throw a football because it's the same motion, but they can't snap the ball. They've got to throw a spiral. So you get some neuromuscular firing patterns back. You mentioned medicine balls or small plyo balls that with two hands on that ball, you can throw it from over your head down onto the floor. So you're not just doing a one-handed activity. Then a gradual return to throwing. Now that may be, if you were a pitcher or a catcher, you're playing the outfield or whatever. Also some side work to see if you have reactivity to what you did. And if you can do those things over the period of 5 to 7 days, from let's say somebody just strained their shoulder, they had some pain, then I think you're okay. If you've had a major injury, you have to have the proper range of motion. You have to have normal strength in your shoulder blade muscles, your rotator cuff muscles. And think of it this way. The upper extremity is a cascade. It is a waterfall. So the shoulder blade, the shoulder, the arm, the elbow, the wrist, and the hand all have to flow together. And if there's any problem in that cascade, the water backs up, so to speak, and you have bad mechanics. So in reality, it's flexibility, pain-free flexibility, normal strength, and then you return to throw.
Brian, I want just to have you expand on one little thing then. You know, the concept of going 30-foot, 45, 60-foot, 90-foot on throws. What is your approach, or how long are those intervals? And when do you say, is it, if my son who had a sore shoulder is now back throwing again, and he's making 90-foot throws comfortably, would you let him back on the mound, or does he have to get to 100 or 120 feet? What are the guidelines that you might use?
We like to see pitchers get out to 100 feet before we let them get back up on the mound.
So that's a long toss throw.
Long toss throw.
So we generally go from a short toss to long toss. They've got to graduate from one to the other, short toss, long toss. Then they successfully complete a long toss before then we'll let them get back up on the mound. And our rule of thumb is a rehab pitcher, a rehab injury, they're always trying to recover location first, velocity second, and then finally, if they're of proper age, to move the ball. It's all, and change of speeds is more important. Location is still the #1 issue.
Chuck, the other thing I'd just say real quick, that's professional. If you're talking about a kid age 12 to 18 and you're back on that interval throwing program and they're still doing some physical therapy or rehab, they should do those rotator cuff and scapular exercises on one day and throw on the opposite day. At that age, they probably shouldn't do their rehab and then an hour and a half later go out and throw. So it should alternate that.
So I think you're advising that should kids not throw on consecutive days? We don't on a professional level, and I think that's what our message is for children too. I want to give one apology to our listeners. Apparently we do have a problem that the Overuse brochure site is down right now. It's
been overused?
It's been overused. Unfortunately, it will be up tomorrow by 9 a.m. from what I'm told from our crack IT staff here. And I think we're close to closing down here, and I want to appreciate everybody. Please, again, rushortho.com is the website where you see the a lot of the information we talked about today in the Positive Coaching Alliance. Certainly those are your two resources, and we hope that everybody has a chance to visit www.positivecoach.org. So I want to say one last thing. If you do have questions, if you go to the rushortho.com site, we have an Ask the Doctor question site where you can leave your question, and somebody from our fine professional staff will get back with the appropriate response. So I want to thank everybody tonight, our crack behind-the-scenes staff spinning the dials, as well as Dr. Greg Nicholson, team physician for the Chicago White Sox and Bulls, Brian Ball, assistant athletic trainer for the Chicago White Sox, and longtime University of Louisville and Memphis in Kentucky fan and trainer, and myself, Chuck Bush-Joseph. With that, I'll say thank you and good evening. Sit down.